Chairman, members of the committee, my name is Keith Cheatham. I'm representing the Virginia Chamber of Commerce. In the 1 minute that I have, I'd like to review with you the national debate on health care that's been raging for the last 8 months, and essentially say it's really about cost, affordability, and access. It is at that level. It's not resolved there. It is at this level. I don't know that we'll resolve it here today. We know that mandates make health care more comprehensive, and every time we add a mandate here in Virginia, we certainly have a more comprehensive policy, but we also have a more expensive policy. This is probably one of the more expensive mandates that you've been asked to consider. I'll not recite the costs. You know what they are. As Doug Ray said, they only apply to a small number of employers in Virginia. It's not everybody. It's a very small percentage. I think he said 16 to 20%. I guess we're disappointed to see here, and somebody's already alluded to it, the number of exemptions of other employer groups who are not in the bill. Some of the smallest employer groups are expected to cover this mandate, while the state workforce, local government workforce is exempt for some time. I think if people understood what the cost just to the state workforce was, it would be a mandate that you would likely pass on. Thank you very much.
Hello, I'm Katie Hellebush with the Virginia Hospitality and Travel Association, and I just want to reiterate the importance of affordable health care to our members and align myself with the comments made before in opposition to this bill. Thank you.
Mr. Chairman, members of the committee, I'm Lori Peterson Aldrich with Virginia Retail Merchants Association. This mandate would actually hit a lot of our members. While we do have a lot of the small retailers, we have a lot that are in that middle ground. So this would add additional costs, and obviously that's our primary concern here. We need to keep health insurance affordable so that we can cover more of the masses.
Thank you. Anyone else to speak? All right. Doug Morgan.
I have a question. In the handout that was presented to us, the excerpt from the 2008 report from the Council of Affordable Health Insurance. This indicates that the autism insurance, the estimated cost was less than 1%. It was the lowest of, I believe, of all the mandates. Contraceptives were 1 to 3%, for example. This is from the Council of Affordable Health Insurance. Is this, are we talking apples and apples? Is this the bill that we are talking about?
Yes, sir, except that of the 15 states that have passed the legislation, all of them have higher, all but one of them have higher dollar caps and more expansive age ranges than what you're considering here. In fact, 2 of them have no dollar caps at all.
So, then the result would be that this is lower cost.
That's correct.
Okay, then, and maybe I could ask Doug Gray, representing the insurance industry, how can it be said? Someone, I think, has talked about this being such an expensive add-on. If we do mandate it.
Yeah, I mean, I don't know what goes into the number that you're talking about. It's a national group that's publishing a number across different states. What I do know is here we were predicting $2 per member per month for small businesses, which are now exempt. So I mean, that I think our total was $40 million for that just last year.
Mr. Morgan. Doug, you're representing the industry.
Yeah, you're trying to hold up a page from somebody else's study at a federal level. I don't have the answer.
But you're quoting numbers.
Yeah, I'm telling you the numbers that I was given for last year's discussion.
For this bill?
If somebody tells you they know the numbers for this bill, I think they're misleading you. I mean, this bill I've seen for all of an hour.
Okay. Thank you.
Mr. Chairman,
Delegate Juwan.
is the bill that has been handed to us include all the people that we have let out from 99 to 103 on page 4. In other words, if you've got all these employers in Virginia, and this is the sheet that we came out with, what happens when you cut out health care coverage offered to state employees, coverage offered to employees of local governments, local offices, teachers, retirees, and dependents, such employees, teachers, and retirees pursuant to 2.2.1204. If you cut all that out, did these figures do that?
Yeah, let me just address that. We have the actuary here. These are national figures. I'm going to tell you that I'm aware of the warps that mandates have, and I'm aware that this does exempt certain groups of people. Having said that, mandates have been around and work, and we have a number of them in our law right now. They do set a standard for the industry. This problem is not going away. And this bill is as narrowly drawn as we can get it to do the most good for the buck. And it does not, let me just finish it. I'm not going to change your mind, Johnny, but let me finish it up.
You might, but you're not heading down the path because...
Yeah, I think Delegate Joanno has a specific question he's getting at that I think we need to get to
Well,
that answer.
I have the actuary here if you wanted. We can talk dollars. I will say this. We did... the state employees are not exempted forever. This is just a delay. We have the experience from South Carolina, and if our experience, we'll learn that process. But this bill is drawn to try to do the best we can with what we have. And I didn't hear Mr. Gray come with any statistics like we wanted about. So I'd be glad to have our actuary speak if you'd like, or we could just move on. But Johnny, go ahead and try again. I'll try to answer your question.
We're not going to get into running debate. We'll get questions. We're at the stage of getting questions or information for the subcommittee, and we'll do that. Joanno, did you?
The only question that I had was, in these figures that Doug handed here.
Is your question direct? Do you have a particular person you want to?
These questions, in other words, these cost figures, do they include the exemptions on lines 99 through 103? Yes or no?
We try to give you, these are national figures.
No, they're national.
If I understand that, I would bet you that the state bills are all over the map, and that some of them do and some of them don't, and that would be a state.
There's somebody that can give a direct yes or no answer to Delegate Joanno's question.
If I understand the question. I mean,
These figures given to us,
yeah.
okay, have lines 99 through 103, have they been taken into consideration? In other words, if you're not charging it to employees of local governments, et cetera, are those figures out of this, and this is the correct figure for Virginia right now? Or is this a national figure that is across the country of all the states?
It is both a national
just
figure
speak to the
and,
microphone.
oh, I'm sorry. It is both a national figure and correct for Virginia right now.
It's not.
That doesn't answer.
It's not bill specific.
What you're holding up is not bill specific, but the Oliver Wyman actuarial study that we have previously provided is bill specific. It is specific to House Bill 303. It does, and Mr. Lambright, please correct me if I'm wrong here. It does not take into account the committee substitute because this was prepared 15 days ago. However, the committee substitute just makes it more restrictive. When this was prepared, there was not a $35,000 per year cap on the benefits. Now there is, per the committee substitute, there is a $35,000 per year cap on the benefits. Also, when this was prepared, the benefit ran through age 9, and now it stops at age 6. So that makes the cost even more contained.
Delegate Nixon.